Hello everyone, welcome to Visan's Anatomy. I hope you would have tried the spotter in mandible and I think it should be an easy one. Now we will evaluate the marks. Before that, most of the students you have said the video is very useful and it is a descriptive one, and thank you so much for your valuable comments, and keep on giving the comments, and please let me know if you want to do any topic in specific, and we'll just move on with the answers. Already we know the evaluation. So each spotter carries 3 marks. If at all any subdivision is wrong, it is wrong. You should not give marks. Okay, if it is a half, answer is right. You can give half of the mark. And already we know that the time given for each spotter is 1 minute. So you should use the time very wisely. You should not unwantedly write the words as the parts of the bone are and the type of the bone is. So you should not write like that. You should just write the answer up to the question. So for example, in this spotter 1, it's been asked as mention the parts of the bone. So you should write only the parts. You should not write as the parts of the bone are so and so. It's not at all necessary. So all these words will just grab your time. So you have to just cut short all those things and you have to just write only the answers. Right, and here the first question is the mention the parts of the bone. So all the separate bones will have parts. Parts in the sense specifically it will be having some parts. For example, for a human body we'll have parts of the body as head, neck and so. So like that. So you should mention parts in the sense you should mention only those areas. So here in mandible, you should not write head of the mandible or neck of the mandible, coronoid process, condylar process or alveolar process or any other thing as parts. That is wrong. You should write only body and ramus, and that too you should specifically say as pair of ramus. If you have left the word as pair, you should give only the half of the mark. So the parts of the bone is the body and pair of ramus. And type of bone is cortical bone, and you should explain the cortical bone. It's not necessary that you should use the same words what I have taught you. You can understand and you can use your own words to write the answers without changing the anatomical terms. So the spongy bone is the one which is placed in the middle, and on either side it will be covered by the compact plate of bones. Spotter number 2. The processes of the bone are condylar process and coronoid process. And the ossification is endochondral ossification, which means it takes a cartilage model and then it is calcified. And the development is from the first pharyngeal arch or the mandibular arch. Spotter number 3. The colored area is symphysis menti. So its embryological significance is, even though the mandible is an unpaired bone, it develops as 2 equal halves. And this is the point where the fusion of both the halves of mandible takes place. And the fusion time is 2 years after birth. Spotter number 4. The arrowed structure is the mental foramen, and the structures passing through are mental nerve and vessels. And the position of this mental foramen in infants, it will be at the lower border below the molar sockets. Spotter number 5. The colored area is pterygoid fovea. So here you have to carefully notice that it is in the condylar process. So you should not write as condylar process or head of the mandible. If at all, if you have doubt, always you read the B question. So the B subdivision will give you the answer. So name the structure attached to it. So structure in the sense some structure is attached. So it should not be the head of the mandible or it's not the condylar process because they are forming the joint. So they are not attached. So here you have to identify as pterygoid fovea, and the structure attached is lateral pterygoid. And the C itself, it gives you a clue for B in which process A is present. So obviously A will not be as a condylar process. So C is condylar process. Spotter number 6. The colored area is external oblique line. And name the structures attached to A. Here the B subdivision carries 2 marks. So you have to write all the muscles attached to the line. So you have 3 muscles: buccinator, depressor anguli oris and depressor labii inferioris. If at all you have changed the order, it's okay. You can give marks. Spotter number 7. The colored area is angle of mandible. For male, it is everted, and for female, it is inverted. And the other structure for the determination of sex, mental protuberance, it is sharp and prominent in males, whereas in females, it will be blunt and round shaped. The body of the mandible is V-shaped in males and it is U-shaped in females. Even you can add the another point as the bigonial distance will be more for females and it will be less in males when compared to the females. Spotter number 8. The colored area is lingula and the structure attached to it is the sphenomandibular ligament and it is developed from the remnant of Meckel's cartilage. Spotter number 9. The arrowed structure is mylohyoid line and the structures attached to it are the mylohyoid muscle and the pterygomandibular raphe at the posterior most aspect of the line. Spotter number 10. The arrowed structure is mandibular foramen. So here you may get confused whether it is a mandibular foramen or as a mandibular canal. So you should read the B subdivision. So it is asked us how does A continuous as. So A should be exactly or definitely the mandibular foramen because the mandibular foramen is the one which continues downwards as mandibular canal and the mandibular canal it exits or it terminates at mental foramen. Spotter number 11. The arrowed structure is neck of mandible. We have already learnt many structures are related at the neck of the mandible. So here I have mentioned only 2 structures. You can write any 2 structures that is related. So here I have mentioned the termination of facial nerve as well as the external carotid artery. And the clinical significance is the neck is the commonest site of fracture. Spotter number 12. So here it is given as the identify arrowed structures. So you should always clearly read the question as whether it's given as singular or plural. So here it's given as arrowed structures. So you have to write both the genial tubercles as superior and inferior genial tubercles and name the muscles attached to it. So the genioglossus and geniohyoid respectively. Respectively in the sense genioglossus is attached to the superior genial tubercle and geniohyoid is attached to the inferior genial tubercle. So in order to save time, you can write the name of the muscles and at the end you can just add a word as respectively. Spotter number 13. Identify the colored area. So here it's not a point of getting confused with the mylohyoid line because mylohyoid line is present in the body. Just below the teeth sockets you can able to see the mylohyoid line, but whereas the mylohyoid groove it is present in the ramus and that too just below the mandibular foramen. So here it is mylohyoid groove and the structure passing through it is the mylohyoid nerve and vessels. And they are the branches of inferior alveolar nerve and vessels. Spotter number 14. Here the identify the colored area. The colored area is it's not specifically any term is used. Actually this is the area, rough area for muscle attachment which is seen on the medial surface of ramus of mandible and the structure attached to it or lodged is medial pterygoid muscle. Spotter number 15. The arrowed structure is coronoid process and the structure attached to it is temporalis. And the age changes because of the measuring angle in infants and old age that is obtuse. So the coronoid process will be at a higher level in comparison with the condylar process. Whereas in adult the angle will be more acute than the infant and old age. So the condylar process will be at a higher level than the coronoid process. If you find this video useful, share and subscribe and hit the bell icon to get the updates immediately. And personal anatomy classes as well as online coaching classes are undertaken. The students, those who are interested, can contact me in the email ID given below. I'll meet you in the next video. Bye-bye.